and stuff like that. It takes a moment. Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we have a great show for you, another great one, and we're going to talk about a topic. The topic is going to be ENT, or ear, nose, and throat. But before we get into that, I want to remind you, caring and sharing. Share your opportunity to come out and tell us about what's going on with you so that we on this show can produce and pull through topics that are important to you. That's the most important thing, that we relate to you and pull topics down that are important to you so that you can be an educated healthcare consumer. That's what we want. So remember, www.medmoments, don't forget the S.com. Email me. I love those emails. And you can tweet me at medmoments. All right? So I'm so excited about this show tonight. I do want to go into this segment, though, before we get to the main topic. Let's talk. You know that let's talk that topic where I just want to ask you or tell you something that I think is important for you as far as relating to your physician. Here's some questions that you should ask when you're at your physician. If he's going to send you for a test, what's that test for? That's an interesting thing. And describe the test. Is it going to hurt or something like that? How many times have that particular physician done that procedure? If he's going to do a procedure on you, you want to know if he's really experienced at it. So ask him, all right? When will I get my results? Will it be 2 days, 2 weeks, 2 months? Will I be sitting home shaking, waiting for those results to come in? Ask him when those results will come in so you'll have some idea, all right? Do I need this particular treatment for what I have? Can I get away without treating it? That's always an interesting question. Are there any alternative medications or treatments that I can take? All right? Possible complications. If he's going to do something, what are the complications? All right? And how long will it take me to get well from that procedure that you're going to do? All right? Which hospital is best for the problem that I'm having? If there are 3 hospitals in the area, one hospital may specialize in a particular problem. That's the one you want to go to. All right? And spell the name of that medication. So if you want to later, you want to look it up or you want to get more information about it, you can. All right? What are side effects for different medications? And does this particular medication that you're putting me on, will it interact with medications that I'm already on? These are important questions that you should ask your doctor. Okay? All righty. Well, as far as what we're going to do today, ear, nose, and throat is our main topic. And I have the perfect person to go over this particular topic. His name is Dr. Derek Lee, and he's an otolaryngologist. All righty? Fancy word. It means that I'm an ear, nose, and throat specialist. Dr. Lee, welcome to our show.
You're welcome.
All righty. So I would just want to get to my first question. And the first question will be, of course, what is ENT?
ENT is basically a physician surgeon that take care of the whole area, below the brain to above the collarbone. So it include all the disease the diagnosis, the treatment of any disease that in this area.
Okay.
It's treat the whole region.
All righty. So what you're talking about is probably at the base of our eyes, coming down, probably under our eyes.
It's between here and here.
From here and here. So the collarbone's right about here.
Exactly.
So anything above the collarbone and below the eyes, anything in that region, an ear, nose, and throat physician will take care of.
We also treat the fracture of the eye socket. So we don't deal with the eyeball itself because that's the area of the eye specialist.
Right.
But even the eye socket, is any kind of fracture, we also handle those.
Interesting, interesting. Now there are several, I know if someone comes to your office, there are several little tools that you use to help guide you or understand what's going on. There's one called the otoscope. Tell me about an otoscope. What does that do?
The otoscope is a specialized instrument that we use to examine the ear. It has a channel go directly into your ear canal. It has a light source, so you can, by looking through it, you can look at and examine the ear canal, the skin, any abnormality in the skin, any kind of infection, any kind of growth in the area,
Right.
any kind of bony formation, and you can look further down into the ear canal and see whether there's any foreign body. A lot of people use cotton tip applicator to clean their ears, or even a toothpick to clean the ear, and they wind up traumatizing it or causing any kind of injury, bleeding, or wax buildup. And little children put beads and little piece of Lego into their ears. So we take them out all the time. And then you can also, by looking further down, you can see the eardrum.
Oh, all right.
And whether the eardrum is intact or not, whether it's red or swollen or bulging, that gives you a lot of information, whether the eardrum move or not.
Right.
It also is important. The otoscope also is connected to a little bulb that you can squeeze air through it, and so you can check the mobility of the eardrum. You'll be able to assess whether the eardrum moves or not. It's supposed to move, obviously. And you can tell where the eardrum is withdrawn. It was sucked in because of abnormality in the nose. It can also tell you where there's any fluid behind the eardrum.
Right.
So you can tell where there's any infection, because the eardrum is translucent, and you can see sort of what's
translucent means you can see through it?
Semi-see-through kind of situation.
Right, right.
So you can kind of see through it and see whether there's any kind of fluid behind it, or any bubble, or any air fluid level, or whether there's any pus behind the eardrum.
Goodness, that would be an infection.
That would be an infection. Or then there's a hole in the eardrum. And you can also, from looking at it, you can also see the 3 bones that connect the eardrum to the nerve in the inner ear.
And that allows us to hear.
That transmit and magnify the sound. Those 3 little bones has to be connected, and you can see whether any kind of infection can break them down, or any trauma that can disconnect them, causing hearing loss. So there's also, you can see through where there's any kind of a blood vessel formation that cause certain problem, like a pulsation. So there's a lot of things that you can see through, a lot of information that you can see through the otoscope.
Okay. There are 2 things that I want to ask. So I just sparked up the old brain there and came. You said that the eardrum actually it vibrates, you said?
It's supposed to be mobile.
Mobile. Yeah. So when the sound comes through, it hits the eardrum and it kind of vibrates. That's why we hear sound. Is that how it happens?
When the sound hit the eardrum, it vibrates it, and the 3 little bones called the ossicles magnifies it.
Oh, and the sound gets louder.
It's like a louder.
Right.
It's like an amplifier.
Right.
Amplify, and it transmits the sound into the nerve ending, and then it's trigger a signal to the brain.
Question. I always wanted to ask this for why sometimes you can hear your heartbeat in your ear. Like if you're laying down and all of a sudden you hear your pulse, boom, boom, boom. Why does that happen?
Well, because there's a major vessel from the neck going up through the bone in the ear,
Right.
and then go to the brain. And so certain people has a very thin layer of bone between, and you can hear the sound transmitted.
Oh.
The other thing is that there is an artery that runs right in front of the ear. And that artery, you press down it and you cover all the noise surrounding you.
Right.
You can hear the pulsation
the
of that artery.
Oh, all right.
And so
That's why that happens. Interesting, interesting. Tell me about, now I know we talked about the ear a lot. I want to talk about the mouth for a minute. The one thing that we use a lot, and you always see the doctor using, is a tongue depressor. What is he looking at back there when he's pressing down and you're almost gagging and he's just telling you to stay still? What's going on back there in the back of the throat?
Well, when you examine the throat and the mouth,
Right.
you have to look at everything.
Right.
From the lip to the inside of the mucous lining, the teeth, and the tongue, underneath the tongue,
Right.
and then behind the tongue, and there's the throat, and there's all that mucous membrane. And
Now, when you say mucous membrane, what's a mucous membrane?
The mucus lining, the inner lining of the throat and the mouth.
Inner lining. And when you say mucus, that means that it secretes a certain, it gives off secretions, or it lets secretions go, or fluids go into the mouth, makes the mouth moist?
There are multiple minor saliva glands on the surface.
Right.
And it's mixed saliva to help you to lubricate the food as you swallow.
Okay.
As you process.
Make saliva, you mean spit, right?
That's the layman's term for it.
Yes.
So it produces saliva.
Okay.
And you have to look through, make sure there's no infection in any of those areas, or asymmetry between the two sides. So give you an idea the condition.
Right.
Of the mouth and the throat.
In the throat. Now, the third thing that I think is most important as far as the ear, nose, and throat is the nose. And there's something called a nose speculum. Tell me about that. And when you look up the nose, what you're looking for and what you're trying to see, make sure everything is normal for a patient.
The nasal speculum is an instrument that we use to examine the nose. It have two prongs that opens it up so we can see. By angling it this way and that way, you can see different area of the inside of the nose.
Right.
And so the inside of the nose have 3 different shells. We call it the turbinates.
Oh.
There's the lower, the middle, and the upper one. And the sinus open into the inside of the nose. And we'll look through that and make sure there's no infection or polyp or any bleeding or any narrowing of the breathing room.
Right.
Office as a growth is a concern.
Okay. So there are different things that you're looking for. Describe what a polyp is. What is a polyp? You mentioned that.
Polyp is a redundant excess lining of the nose.
Okay. So it's like an overgrowth, tissue, overgrowth of tissue in an area.
Exactly.
Okay.
Exactly. And it means that there's some kind of inflammation in the area.
Or swelling.
Or swelling.
Right.
Leading to it.
Right, all right. And that can block the nasal passage, that can block your ability to breathe and just to breathe easily?
Definitely. That will cause some obstruction in the airflow, and people will be uncomfortable.
Right, right. Okay. Now tell me about, since we're talking about the nose, tell me about the septum. The septum is that area that divides one nose from another, one nostril, I should say, from another. Is that what it is?
Septum is like a common wall between two sides.
Right.
It separates the right from the left.
Right.
And it's supposed to be straight.
Right.
But oftentimes, whether with an injury or they are born, they're narrow, or one is crooked as one side is pushed over,
right, and
resulting in obstruction, and so you have breathing difficulties.
Because the septum, if it's not going straight, then it's going crooked, so one side of the nose is not, you're not able to get air in and out. So it's called a deviated septum?
It's called deviated septum. That's correct.
Okay, all right.
Deviated meaning that is not in the middle.
Right, it's pushed over to one
pushed over
side.
one side or the
so,
other.
so that's what some of the things that you do. You would actually go in and straighten that out.
We do in patients that have difficulty with breathing and not responding to medications, then we have to go in and straighten it out so they can breathe better.
Okay, all right then. Not to hop around, but there's just so many things I want to ask. My mother used to always say the only thing you should put in your ear is your elbow. All right, and simply because you could damage your eardrum or do some really serious damage. Tell me about how someone should really take care of their ears. And for instance, the most common thing I understand is wax in the ear, and people are always trying to clear their ears of wax. How should they handle that?
Cleaning the ear is best performed with ear drops. You can buy the drop from for the ear from the drugstore.
Right.
It's over the counter, so you don't need a prescription. What the drops does is that it softens up the wax,
Right.
so that it can leak out. And so you can put the drops in and wait for it for about half an hour or so, and then it will melt the wax. So the wax, instead of a solid form, become a liquid form. And then as you flush your ear with water, when you take it in a shower, for example, then it comes right out.
Right.
So you don't have to be putting anything to clean it. A lot of people use Q-tips to clean
Yeah,
it.
the Q-tips, huh? Yeah.
But the Q-tip doesn't really clean it. You wind up pushing the wax in.
Oh.
The ear canal, contrary to common belief, is not a straight tube. It's almost like an hourglass. It had the outside is wider, the inside is narrower, and it opens up again to the eardrum. And it's actually curved. And so when you put a Q-tip with a straight in there, you're going to hit something. And then if you put the Q-tip past the narrowest point, called the isthmus, you can actually, the cotton got trapped.
Oh, inside.
And when you pull the Q-tip out, the cotton stays in there, and you only get the stick.
Oh, get the stick back, huh?
And so you leave the piece of cotton in there, and you wind up having hearing problem.
Oh my goodness.
And the other thing is that the Q-tip keep pushing it in,
Right.
so it wind up getting it all impacted.
Right.
So that causes problem also. So we have people coming to the office with hearing problem,
Right.
well, with foreign body in the ear. And in certain scenario, they actually cut the skin in the ear canal
Oh goodness.
and cause a lot of pain. In the ear canal is very thin. The skin in the ear canal, I meant,
This is very thin.
is very thin, and but it's important for that thin layer to be complete, because if you scratch it or cut it,
Right.
it opens up and you get infection to go underneath it, and you get this ear infection. And so that's why it's very important not to traumatize
Right.
the skin in the ear canal.
Okay. Okay. Excellent. Question. When I'm in the airplane, and either it's going up or it's coming down, why does all of a sudden I lose my hearing and I just can't hear anymore, and it's hard to try to clear my ears? What's actually happening at that point?
It usually happen on the way down.
Okay.
When the plane descends.
Right.
What I mean, when the plane goes up, the cabin pressure is getting less and less. It just go higher and higher.
Right.
But when the plane descends, the cabin pressure increases.
Right.
And as the air pressure in your as the cabin pressure increases, it presses on the eardrum.
Oh, all right.
And so the more you press it, you have to swallow or pop your ears to try to equalize the pressure.
Equalize. Oh.
the air pressure pressing on the eardrum is balanced by the air going through the nose. And behind the nose is a secret tunnel between the back of the nose, the space behind the eardrum called the eustachian tube.
Oh, all right.
So the air has to go through that in order to balance both sides of the eardrum. And for a lot of patients, that whether they have allergy or a deviated septum or have a cold when they fly, and there's some blockage or inadequate airflow through the nose and connected to the eardrum, through that tunnel to the back side of the eardrum. So they cannot balance it. And that's why the pressure going from the outside in, pressing on the eardrum, is not balanced. So the eardrum is stretched. When the eardrum is stretched, it doesn't hear very well. Because it takes more sound energy to vibrate the eardrum. And that's why you can't hear too well.
That's why you can't hear.
You feel like you need a louder sound to hear.
Right.
But oftentimes, all you need to do is drink some water, or you pop the ears. How do you pop the ears? It's very simple. You close your mouth, you don't let any air go through the voice box, and you pinch your nose and you blow. And the air is forced as one way to go is go through that tunnel, eustachian tube, to the ear.
Oh, interesting. Talk about losing hearing and hearing aids. Is it normal as you get older to lose your hearing?
It's normal to lose a certain amount of hearing as you get older.
Okay.
Just like your eyesight, you're getting, you need glasses to see a little better. As it's the same reason as the nerve ending is deteriorating. So we take a louder sound for you to hear. And so when you notice that, you should get a hearing test so that you can check the current status of your hearing capability. And when it is get to a certain point, you might need to use a hearing aid in order to boost the sound so you can hear.
What about ringing in the ears? A lot of people have this, it's always ringing, I hear it, or it may not hear it during the day, but when they lay down at nighttime, and I hear some of my patients say, oh, I hear this ringing in my ears all the time. Why does that happen?
Ringing in the ear is almost, you can look at it like a short circuit of the hearing nerve at the nerve ending that cause it not have the buzzing sound in your that you notice. And even to these days, there's no real cure for it.
Oh, really?
It's more noticeable when you're alone, when there's nobody's around, or when there's no sound. And you notice it more.
I know one of my patients came in and she swore she had a brain tumor because she has this ringing in her ears all the time, I mean, but it's something that happens that maybe just over time the nerve ending is just not appropriate, and you hear this?
It happens as you're getting older. If it's only one-sided, then you have to be concerned because it should happen on both sides. If it's one side, there could be something else going on that pressing on the hearing nerve, resulting in that ringing in the ear. So you need to get it evaluated.
Interesting. All righty, we're going to move along here because, and this is so interesting because you just don't think about these things very often, but it's something that I think, come in contact with all of our lives, our ears, our noses. We're always doing something with them. So we should know these things. What about as far as your nose? I understand that your nose, even if you're in a dusty place or something like that, it's a pretty good filter. Tell me what's going on as far as the nose is concerned and what it does for us as far as the air coming in and out.
Well, when the air goes inside the nose, it is filtered by the hair in the nostril. Not everything, obviously. Only the larger particles are filtered. And as the air travel in the nose, go to the back of the nose, down to the throat, go through the voice box into the windpipe. It pick up moisture is saturated with moisture. It also warm up to body temperature. So when the air hit the voice box in the windpipe, it's conditioned.
It's conditioned already. It's nice and warm
Nice and
moist.
warm, exactly.
Yeah.
You remember those winter days when you go out jogging and you're breathing fast through your mouth,
Right.
and you're coughing. Well, why are you coughing? Because the air is not saturated with moisture. It's not warm up the body temperature.
Right.
It irritates your throat and your windpipe. That's why you're coughing.
Oh, all righty. Talk about nosebleeds, because we all get them every once in a while. What should we do if we get a nosebleed, and how should we try to prevent them?
Let's talk about prevention first. Prevention is important. The best way to prevent it is to keep it well hydrated.
Okay.
The mucus lining, the inside,
inside
of
your
the nose,
nose, right.
has to be hydrated. And especially in the winter months when the heat is on, the indoor humidity is low, so it dries up the mucus lining.
Right.
And when the mucus lining is dried up, it cracks open and exposes the blood vessel. And even if you rub your nose or you sneeze or you cough,
Right.
that will enough to for them to break open and they bleed.
Right.
And when you have a bloody nose, don't panic.
Don't panic. All right.
What you need to do is that you need to pinch your nose.
Right.
You breathe through your mouth, and you tilt your nose as far up from the heart as possible. And you watch the clock for about 15 minutes. And that should stop. If it doesn't stop, you go to the emergency room. There's not much you can do.
Right. You have to what? Get it packed or something like that?
You have to get it controlled.
Right.
The emergency room doctor will be able to help you with that. Usually it's by either burn it with a silver nitrate stick if it's a one isolated spot, or they have to put some packing in there.
Right.
And there's a variety of things they can use, from cotton, from Vaseline gauze, from powder, starch powder to dry up the blood, to balloon.
All righty. Well, you know, we're going to have to get you back because there's so many things I did not cover that I wanted to cover, and we're out of time. Okay? Dr. Lee, thank you very much. Thank you very much for coming in and covering this topic. This so important topic.
My pleasure.
All righty. So, in closing, remember, sharing and caring. Remember, email me. Let me know what's going on out there. I so enjoy your emails, and every time I read one, it gives me inspiration to cover another topic so that you can know more about your medical health. All right. Never institute any change in your medical care until you consult your physician. And remember, you can email me at www.medmoments.com. All righty. I trust each and every one of you continued good health. I'm Dr. Obey, and this is A Moment in Medicine. Until next time, I wish you peace to you all.